Okay, let's unpack this.
That feeling after an MRI scan.
Yeah, that moment when you get out, you're holding the scan results maybe,
Mm-hmm.
and you just want to understand what you're looking at right now.
Mm-hmm.
I know that feeling. My first instinct is always to jump online.
Sure.
My Google search that time, AI MRI analysis free.
And what you found was probably a bit of everything.
Oh, a whirlwind. Exciting headlines, research papers that felt impossible to decipher quickly.
Yeah.
And this sense that AI might just be on the verge of making everything clear.
It's fascinating, though, how universal that desire for immediate understanding is, especially with complex medical stuff.
Oh, boy.
MRI scans, they give you this incredibly detailed visual data.
Right.
And the idea that AI could be a shortcut to making sense of it, maybe without extra cost, that's powerful.
Absolutely. So in this deep dive, we're going to try and navigate through all that information.
Cut through the noise a bit.
Exactly. Looking past the sensational claims to understand what's really happening with AI and MRI analysis, especially this notion of free.
And we've looked at a few things, right?
Yeah, we've explored my own late-night online searches, definitely.
Okay.
Had some really eye-opening chats with radiologists, folks who are either using these tools or thinking about it.
That's crucial context.
And even, ventured into the research papers and some open-source code.
Which can be pretty dense.
Tell me about it.
But if you look at the bigger picture, this drive, using AI for quicker, maybe more accessible insights, it's not just medical imaging.
No, it's everywhere.
We see it across lots of fields where you've got complex data that needs interpretation.
True.
But medical imaging is, well, it's particularly compelling because the stakes are so high. Patient care.
Right. So the core question that kept coming up for us as we dug into this.
Main thread.
Yeah. The one we're really trying to answer today is, how close are we really to a world where AI MRI analysis is both freely available, genuinely free, and effective?
And effective can mean different things, can't it?
That's a good point. What do we mean by effective?
Are we talking speed? Accuracy? Just how easy it is to get your hands on these tools?
Right.
That preprint you mentioned, Dew and colleagues, it gives a really interesting angle on this.
Yes, the CycleGAN paper. Okay, let's get into this research.
It's pretty intriguing stuff.
So this preprint, it talks about creating fractional anisotropy maps,
Ah.
FA maps,
Mhm.
directly from standard T1-weighted MRI scans.
Using something called 3D cycle bands.
Now, if you listening have had an MRI, you might not know FA maps, but they actually show really crucial stuff about your brain.
That's right. FA maps are essential. They reveal details about the brain's white matter microstructure.
A wiring.
Kind of, yeah. Think of it as the intricate wiring connecting different brain parts.
Yeah.
Super important for understanding connectivity, spotting tumor boundaries, and just general neuroscience research.
And the usual way to get these FA maps, that involves diffusion scans, right?
Correct.
Which anyone who's done it knows can add significant time to the MRI.
Yeah.
Easily 15 minutes or more inside the tube.
Definitely. And more time often means
More cost. Nobody wants that,
Yeah.
especially with medical
more
scans.
billing concerns.
Yeah, precisely. Diffusion scans need specific imaging sequences. Not all machines can even do them.
Ah.
And they definitely increase the scan duration, the complexity.
Okay.
So this is where the CycleGAN approach gets really interesting. It basically aims to generate these FA maps from the routine T1 images.
The ones that are almost always done in a brain MRI.
Exactly. The standard stuff.
So how does this Google Translate for voxels thing work? Because that's how they described CycleGANs, which I thought was pretty clever.
It's a really helpful analogy, actually. Imagine you have two different languages.
Okay.
In this case, one MRI image type, T1, and another FA.
Normally, to translate, you'd need lots of paired examples. The same brain scan both ways at the same time.
Which isn't always practical.
Right. What CycleGANs do is learn the underlying patterns, the structure of each language on its own.
Independently.
Yeah. And then they figure out how to map features from one to the other without needing those perfect paired examples.
So the AI doesn't need a perfectly matched T1 and FA scan from the exact same moment to learn. That sounds way more efficient.
It is. The paper talks about using twin generators. Let's call them G and F.
Okay, G and F.
Generator G takes a T1 image, tries to make a synthetic FA map.
Okay.
Generator F does the reverse. Takes a real FA map, tries to reconstruct the T1 it might have come from. Then you have paired discriminators. They're like critics.
Critics.
Yeah, they try to tell the difference between real FA maps and the fake ones from G. And same for the T1s.
So it's like a constant competition. each part trying to fool the other until the fakes look real.
That's the core idea of GANs, generative adversarial networks, these competing AIs.
Right, GNs.
And the cycle consistency loss is another clever bit.
What's that do?
It makes sure that if you start with T1, use G to make an FA map, then use F to go back to T1.
You should get something close to where you started.
Exactly, like a round-trip check. Ensures the translation makes sense, basically.
And the results they reported sounded pretty promising. That's image similarity, right?
Right. Structural similarity index.
Over 0.90 in tumor cores. To me, that sounds pretty good.
It is very encouraging, yeah. It suggests that, at least in specific areas like the middle of tumors, the AI-generated FA maps look visually quite similar to real ones.
And the practical upshot.
Potentially huge. If this holds up with more research,
Yeah.
clinicians could maybe get insights into white matter structure from routine scans, effectively getting FA-like info without the extra diffusion sequences.
Ah, so that's where the AI MRI analysis free idea comes back in.
Yeah.
Free as in skipping the costly extra scans.
That's one way to look at it, yeah. A potential cost saving in terms of acquisition time and resources.
But, as the preprint notes, there are still things to keep in mind.
Always.
It's a volumetric model, 3D, which is more complex.
True, more data to handle.
Trained on unpaired data, which is efficient, like we said, but needs careful checking.
Absolutely. Validation is key with unpaired training.
And the fact it seemed to work okay even on brains with big problems like glioblastomas, that was surprising, right? But good.
Very notable, yes. Robustness on pathological brains is a big plus. Often AI models trained on normal data can stumble when they see disease. Still, we need to be cautious. Promising preprint results are great, but they're a long way from rigorous clinical validation.
Like a phase 3 trial.
Something like that benchmark, yes. The researchers themselves say that's still a significant step away. We need bigger, more diverse data sets, different scanners, different people.
Gotcha.
But the immediate potential benefit,
Where could that be?
well, as the paper suggests, maybe in resource-limited settings.
Like rural hospitals?
Exactly. Places where maybe they don't have the newest scanners or the expertise for diffusion scans.
Or it's just too expensive or time-consuming.
Right. In those cases, even a good approximation of an FA map from a standard scan, that could be really valuable. Transformative, even.
Okay, so that widens access to advanced insights.
Potentially, yes. Now let's zoom out a bit. CycleGANs are one piece of this puzzle.
Right, just one tool.
What about the wider landscape of AI tools for radiology out there now?
Yeah, my search for AI MRI analysis free definitely brought up a lot more than just that one paper.
I bet. A huge variety, from serious-looking commercial products to basic demos on places like GitHub.
Mine too, it felt like. Like navigating a jungle,
Yeah.
acronyms, promises.
Uh-huh.
So we tried to make a kind of map of what's out there, trying to separate the hype from the real tools, the paid stuff from the genuinely free.
Okay, what did that map look like?
Well, we looked at companies like Quera.ai, ADOC. They have FDA-cleared tools.
Mostly for CT scans in emergency rooms, right? Triage tools.
Yeah, things like QER from Quer or ADOC's neuro tools used in hospitals, FDA-cleared.
Yeah.
But definitely enterprise solutions. Big bucks. Not free for you or me.
And that FDA clearance piece is important. It's a tough, expensive process.
It explains the price tag.
Understandably. Those companies invest a lot in validation and meeting regulatory standards. They often focus on specific high-impact tasks, like flagging critical findings on CTs.
So then you move into the MRI-specific zone,
What did you find there?
things like deep brain sag, from MIT, actually.
Ah, yes, I know that one.
Free for research. Seems particularly good at generating masks around brain tumors.
Right, segmentation. Useful for researchers needing quick tumor outlines, though it can need some serious computing power, like a good GPU.
Good point.
Yeah.
Then there's FastSurfer, also free, research-focused.
FastSurfer is impressive. It does cortical parcellations, dividing the brain's surface into regions very quickly.
Yeah, and the developers seemed really active,
Yeah.
supporting the community.
That's a big plus for research tools. Active support makes a difference.
And of course, you have to mention FreeSurfer.
The classic. Been around for ages.
Kind of the baseline, the gold standard in a lot of research papers, even if it's slower.
Exactly. It has a long track record, huge user base, important for reproducibility in research.
And then you get to places like GitHub, Hugging Face,
The Wild West.
pretty much lots of MRI analysis demos, totally free, but zero guarantees, right? No real validation. Explore at your own risk.
That sums it up well. Great for experimenting, seeing what's possible, but you wouldn't rely on them for anything critical. They just haven't been tested thoroughly.
So the pattern seems clear if it's got that FDA stamp.
It's commercial, comes with a price.
And the AI MRI analysis free stuff mostly lives in the open source research experimental world.
Which makes sense. The cost and effort of regulatory approval are significant hurdles.
Yeah.
It reflects the level of proof needed before you use these clinically. The free tools. Incredibly valuable for research, for pushing boundaries, but not for diagnosing yourself online.
Which brings us to that really critical question. Can AI actually read an MRI as well as a trained human radiologist?
The million-dollar question.
It really is. And the answer seems to be, it's complicated. Sometimes yes, often no, never absolutely.
That nuance is vital. Accuracy isn't a single number. It depends on so many things.
Like what?
Well, the specific MRI scanner used, the exact imaging protocols, how complex the patient's condition is.
The range of human pathology is huge.
Exactly. AI might be great at spotting one specific thing it was trained heavily on, but miss something unexpected.
So this is where we need to be super careful about those online claims. Free AI MRI diagnosis.
Big red flags, potentially.
Our research really hammered home some key questions you should ask if you see those.
Such as?
Like, where's the peer-reviewed evidence? Is there a published study?
Crucial.
Was the AI tested on data from the same hospital where it was trained? Or on diverse external data?
That's a big one. Performance on internal data can be misleadingly high.
And who decided when the AI was wrong? Was it an experienced radiologist checking the false positives or someone less qualified?
Good point. Adjudication matters. How are errors defined and counted?
So yeah, AI MRI analysis free isn't a simple yes-no. It's more like a probability. Depends on technical factors, socioeconomic factors.
A whole web of things. And yeah, if some random website asks for your credit card for a free diagnosis,
Run away.
pretty much. High-quality medical image analysis needs serious resources, serious expertise, free online diagnosis, especially asking for payment details. Highly suspect.
Okay, so given all that, who actually stands to benefit most from the AI MRI tools we're seeing now? Especially the free or research-focused ones.
Let's think about specific cases. Rural hospitals came up.
Right. How could they benefit?
Well, like we discussed with CycleGANs, if they lack diffusion sequences,
Yeah.
a tool that generates FA-like info from standard scans, that could be incredibly valuable. Gives clinicians more insight without needing costly referrals to bigger centers.
So even if it's not a full diagnosis, it's extracting more value from what they already have.
Exactly. A significant potential benefit there.
What about, say, busy neuro-oncology centers in big cities?
Yeah.
Often totally swamped.
Yeah, there are tools like Deep Brain Seg. Remember the tumor segmentation one?
The free research tool.
Right. While it's for research, you could imagine future clinical versions helping with initial assessment, quickly estimating tumor volume, maybe?
As a first pass?
Potentially. Helping with triage, maybe flagging subtle things for the expert neuroradiologist to review closely. It's not about replacement.
It's about collaboration, augmentation.
Precisely. AI augmenting the human expert. Helping prioritize, quantify, maybe ease some workload. That's the realistic path.
Okay, what about individuals? People getting their own DICOM data now, the citizen scientists.
That's a growing area for sure. People are engaged, want to understand their health.
So can these free tools help them?
They can act as a kind of, maybe an augmented explanation engine.
Explain that.
Helping you understand technical terms. Perhaps see what an abnormality flagged by the AI looks like.
But not for making decisions.
Absolutely not alone. It has to be a starting point for a conversation with your doctor or radiologist, not a replacement for professional advice. Viewing your own scans with AI is interesting, but clinical decisions need expert oversight.
Got it. And finally, what about researchers? Grad students, labs on tight budgets.
For them, these open source tools are a massive deal, a real game changer.
How so?
They can tackle complex research questions without needing huge grants for expensive software licenses.
Democratizing the research.
Exactly. They can use public data sets like BRATS for brain tumors, grab FastSurfer, and actually test AI accuracy themselves.
So the cost shifts from dollars
To diligence. Time, effort, learning the tools, doing rigorous science. It opens the door for smaller labs to make real contributions.
Fosters more innovation, maybe. Different perspectives.
Absolutely. A wider range of people exploring these problems is good for the field.
Okay, we've covered a lot. I imagine some specific questions might be bubbling up for listeners.
Probably.
We thought about some frequently pondered questions. FPQs.
FPQs, I like it.
Let's try a few. First one. Can I get free online MRI interpretation using AI?
Interpretation. Sort of, but with huge caveats.
Okay.
Some sites might summarize findings or flag potential anomalies based on your images, but interpretation is not diagnosis.
Big difference.
Huge. And legally, these AI tools cannot replace a qualified radiologist's report. They offer information maybe, but not an official medical diagnosis, period.
Got it. Next FPQ. Why the constant repetition of that phrase AI MRI analysis free? We've said it a bunch ourselves.
Yeah. Well, partly it's just SEO, right? Search engine optimization. People are actively typing that exact phrase into Google.
So websites use it to get found.
Exactly. But it also reflects a genuine public demand. People want accessible, understandable insights from their scans, so content creators respond to that need.
Makes sense. Okay, third one. Are these CycleGAN models we talked about, the ones making FA maps, are they the ultimate solution?
No, definitely not the ultimate solution. They're a really clever workaround for limitations in how we acquire data now.
A smart hack, almost.
In a way, yeah. But for really critical decisions, high-stakes stuff, directly measuring those tissue properties with the right scan sequence is likely always going to be preferred if possible.
So fundamental physics still matters.
Absolutely. These generative models are amazing tools for specific problems, but not a replacement for everything.
Okay, last FPQ for now. How can you verify those crazy high accuracy claims? Our AI is 99% accurate.
Yeah, you see those sometimes. Skepticism is healthy.
What should you look for?
Look for external validation. Was it tested on data it never saw during training, preferably from different hospitals or scanners?
Diverse test sets.
Crucial. Is the code open source so others can check it? If not, do they at least provide detailed metrics, like a confusion matrix?
What does that show?
It breaks down the errors. Shows you not just how many mistakes it made, but what kind of mistakes. False positives, false negatives. Much more informative than a single accuracy number.
So if those details are missing,
be wary of the headline claim. Very wary.
this brings up a broader point, almost philosophical, this whole push for free insight.
The ethics of cheap insight.
Yeah. Technology often reflects our priorities, doesn't it? Is there a risk we prioritize free over reliable or reproducible?
That's a real tension, especially with open source AI. You get rapid discovery, fast sharing of code.
Which is great for innovation.
But it also means models can spread quickly before they're thoroughly validated for specific uses, making medical decisions based on unverified code. That's a scary thought.
So how do we balance that? Democratizing the tools versus ensuring safety.
It requires a culture shift, maybe, towards transparent benchmarking, really rigorous testing before widespread deployment, especially anywhere near patients.
And collaboration.
Absolutely. Needs radiologists, engineers, ethicists, patients, regulators all talking to each other. It can't just be tech developers working in isolation.
So we've journeyed quite a way from my simple Google search.
Through the complexities of CycleGANs, FDA hurdles, open source tools.
Yeah. And it's clear that dream of universally free, push-button AI MRI analysis. We're not quite there yet.
Not fully realized, no. But significant progress is being made. Those CycleGANs are genuinely innovative. The open source community is vibrant.
It really feels like the future is layered.
How do you mean?
Like open source providing the foundations, maybe, then regulatory oversight adding safety layers, and ultimately human experts working with AI in the clinic.
Human-AI collaboration seems the most likely path forward in clinical practice, I agree.
So for you, the listener, in the near term, your experience probably won't be getting a diagnosis spat out by a machine.
Unlikely. More likely, AI might offer augmented explanations, insights flagged for your doctor to review.
Tools that highlight potential areas of interest, maybe quantify things, but the final interpretation. Still the radiologist.
That seems the responsible and realistic way forward for now.
And maybe that reframes AI MRI analysis free.
How so?
Not free as in trivial or zero cost to build and validate. That takes huge effort.
Right.
But maybe approaching zero marginal cost per use eventually, making sophisticated analysis more accessible.
Increasing value in early detection, maybe reducing that awful anxiety while waiting for results.
Exactly. Lowering barriers, increasing understanding.
That's a powerful potential outcome, this whole quest to understand ourselves, especially the brain.
It's so tied up with the tools we invent.
It really is.
Yeah.
And watching AI meet medical imaging, it's a fascinating chapter in that story.
Absolutely. And speaking for myself, I'll definitely keep reading the papers, talking to the experts, staying curious.
Me too. It's a field moving incredibly fast.
Well, thanks for digging into this deep dive with us today. Lots to think about.